Hello and welcome to NCLEX Made Simple YouTube channel. Here we prepare content for you to enable you pass the NCLEX within the very first attempt. So kindly be checking on our videos so that they can help you with your revision. So today, welcome. We are going to discuss a condition called dumping syndrome. This is a condition that is tested in NCLEX exams. So take good note of it and let us learn together. Dumping syndrome is a cluster of symptoms that can occur when undigested food moves too quickly into the intestines. The symptoms typically occur after eating a large amount of food or a high carbohydrate diet or a high fat meal. It's most frequently associated with gastric, esophageal, or bariatric surgeries. Dumping syndrome has also been reported in patients with diabetes, cyclic vomiting syndrome, Zollinger-Ellison syndrome, and it can occur even after a bolus tube feeding, especially if the formula is of high osmolarity or a feeding is given in large amounts over a short time. Several surgical procedures may lead to the dumping syndrome. Example is the gastric bypass. It can lead up to 75% of the dumping syndrome. Then we have gastric sleeve, about up to 40%. We have esophagectomy, fundoplication, gastrectomy, partial gastrectomy, and vagotomy. All those types of surgeries can complicate into dumping syndrome. So let us now look at the pathophysiology of dumping syndrome. What happens when you take a meal and this meal rapidly empties into intestines? Three things happen. The hyperosmolar jejunal chyme. Chyme is this partially undigested food. It is highly concentrated. That's what we are calling hyperosmolar jejunal chyme. When it is there, fluid gets into the intestines from the surrounding interstitial spaces. And now when that happens, there will be decreased blood volume, and this can lead to hypotension and tachycardia. And now, because fluid moves into the intestines where there's hyperosmolar jejunal chyme, or where there's partially undigested food has been dumped, there will be a lot of fluid there, causing bloating, abdominal pain, and diarrhea. Then the other thing that can happen with dumping syndrome is that when there is rapid gastric emptying, there will be inappropriate gut hormone release. And when this happens, this leads to vasomotor and GI symptoms. We shall look at them in our next slide. The other thing is that there will be rapid glucose absorption. When there is rapid gastric emptying, when you take a meal, there will be rapid glucose absorption. There will be rapid glucose absorption, and this will lead to inappropriate insulin release from the pancreas. When there is inappropriate insulin release, the patient will exhibit symptoms of late hypoglycemia. Let us look at clinical manifestations. Dumping syndrome clinical manifestations are categorized as either early or late, depending on how soon they begin after a meal. Early dumping is experienced by about 75% of those patients who report the symptoms, and it occurs within 30 to 10 minutes after eating. Symptoms arise when the undigested food moves too quickly into the duodenum, causing fluid to shift from the surrounding tissues into the intestines to aid in the rapid dilution of the concentrated food. So this rapid fluid shift into the intestines leads to GI symptoms. It will cause bloating, it will cause abdominal pain, it will cause nausea. The movement of this fluid from the surrounding tissues will also lead to excessive intravascular fluid loss, and this will result in vasomotor symptoms such as diaphoresis, excessive sweating, tachycardia, hypotension, and in some cases there will be syncope. In the early damping syndrome, there will be gastrointestinal symptoms such as abdominal pain, bloating, boborygmy. Boborygmy is a passing of gas, and there will be diarrhea. There will also be nausea and vomiting. Vasomotor symptoms, diaphoresis, that is excessive sweating, will be flushing, headache, hypotension, palpitations, syncope like transient fainting, and tachycardia. Rate symptoms, we have adrenergic symptoms such as palpitations, perspiration, and tremors. Then we have neuroglycopenic symptoms. The patient will have difficulty concentrating, fatigue, hunger, and even syncope. So it is important to note that these symptoms will appear in a patient with damping syndrome. And we have GI symptoms and the vasomotor symptom. Also very important to note which symptoms come up in early damping syndrome and which symptoms are associated with late damping syndrome. Let us now look at the late damping syndrome. This occurs in about 25% of the patients, typically presents 1 to 3 hours after eating. The rapid movement of carbohydrates into the intestine releases an excessive amount of insulin from the pancreas in an attempt to maintain normal glycemia state, but ultimately resulting into hypoglycemia. So the subsequent symptoms are a direct consequence of hyperinsulinic response. So you have a lot of insulin and now the patient goes into hypoglycemia. These symptoms are like fatigue, difficult concentrating, hunger, confusion, perspirations, tremors, and low blood glucose. So how do you diagnose damping syndrome? Number one is through SIGTAD scoring system. SIGTAD scoring system is whereby the patient is asked to circle the symptoms that they experience. Those symptoms are assigned scores that are totaled to make a diagnosis. A total of more than 7 suggests damping syndrome. So the patient is given and told to circle from those symptoms, and then the scores are totaled. So if the score is more than 7, there is likely damping syndrome. So the other test to diagnose damping syndrome is the modified oral glucose tolerance test. This is whereby the patient fasts for 10 hours, then drink a solution containing 50 grams of glucose. His or her blood glucose levels are measured, the heart rate, the blood pressure, and the hematocrit levels every 30 minutes. They are measured every 30 minutes. The glucose level, the heart rate, the blood pressure, and the hematocrit levels. So a diagnosis of early damping syndrome is made within 30 to 60 minutes after the patient, and the patient experiences a 10 beats per minute increase in the heart rate, or the hematocrit rises by 3% in the first 30 minutes. So late damping is suspected if hypoglycemia occurs 2 to 3 hours after glucose ingestion. That is modified oral glucose tolerance test. The other one is gastric emptying scintigraphy. Gastric emptying scintigraphy, a patient is asked to eat a bland meal containing small amount of radioactive dye. So an abdominal X-ray is then taken every hour for 4 hours after the meal to follow the movement of the dye and measure the rate of gastric emptying. Damping syndrome is diagnosed if an accelerated rate of emptying is noted. So in gastric emptying scintigraphy, the patient is asked to eat a bland meal that contains a small radioactive dye. This dye is followed up closely through abdominal X-rays, and the rate at which it is emptying is recorded. So the other one is damping symptom rating scale. This is whereby the patient is given a questionnaire and is reliable for detecting the severity and frequency of damping symptoms. It uses a 7-point Likert scale to grade the severity of 11 damping syndrome symptoms, along with 3 questions about food that causes the symptom. So the other thing we shall look at is the management. Let us now look at the management. And the management of damping syndrome, diet is the most effective way to manage damping syndrome. Patient education is particularly beneficial for people with mild to moderate dumping syndrome symptoms because they respond well to dietary changes. Those with more severe dumping syndrome symptoms may not respond well to dietary changes alone. They may require something else like surgery, but diet is the most effective way. Dietary changes is the most effective way to manage dumping syndrome. So what are these general recommendations you are telling this patient? To eat small, frequent meals, like 5 to 6 meals, small servings instead of 3 meals that are large. Then eat high protein meals and snacks. Avoid liquids with meals. So the patient should not take fluids together with meals. Then avoid simple carbohydrates. Simple carbohydrates these are simple sugars like cookies, candies, sweetened drinks, and ice cream. Also, you need to tell the patient to lie down for 15 minutes after eating. This is to avoid quick gastric emptying. We need to reduce gastric mobility. So now let us look at health education. What are you going to educate this patient who has dumping syndrome? Number one, avoid foods high in simple carbohydrates. And we have said candies, cookies, cakes, fruit juices, sweetened drinks, ice cream, canned fruits in heavy syrup, sugars, alcohol. Such things can lead to dumping syndrome. So tell the patient to avoid foods high in simple carbohydrates. Then eat proteins with each meal and snack. For example, eggs, cheese, meats, fish, poultry, legumes, and low-fat milk. Avoid liquids with meals. Instead, drink 30 to 45 minutes before and 1 hour after the meal. So it's good to avoid liquids with meals for the dumping syndrome patient. Limit the use of caffeine, tea, and alcohol. These beverages stimulate gastric motility. So discuss the appropriate intake of alcohol with your healthcare provider. The other thing is eat 5 to 6 small meals per day to avoid overloading the stomach. Small servings, small frequent servings. Lie down for about 15 minutes after eating to help slow gastric emptying. The other thing is choose high fiber foods to decrease the rate of late dumping. So high fiber foods is important. High protein, we are saying for this patient with dumping syndrome, we are recommending a high protein, high fiber diet. For this patient with dumping syndrome, we are recommending high protein, high fiber diet. The patient should avoid high fat food. That one is restricted. High fat food is restricted. So if it is the fats, they should be low fat. If it's milk, low fat milk. Okay. The other thing is avoid foods high in simple carbohydrates, such as candy, cookies, cakes, fruits, sweetened drinks, ice cream, and canned fruits. All those and alcohol. So that is the health education that you give to the patient. So let us look at the pharmacological intervention. We have several drugs that can be used to manage symptoms of dumping syndrome. The first one is acarbose. Acarbose, it acts by slowing digestion of carbohydrates, and this decreases postprandial rise of glucose and insulin release. Acarbose slows digestion of carbohydrates. It also decreases postprandial rise of glucose and insulin release. So the dose is 50 to 100 milligrams. It is given 3 times per day and given with first bite of each meal. Side effects of acarbose, we have flatulence, abdominal discomfort, and diarrhea. Symptoms targeted are those symptoms of late dumping. Symptoms of late dumping, I told you, are those symptoms that patient will present with hypoglycemia. The patient will feel like fainting, fatigue, all those symptoms. So nursing implication, you should observe patients for signs and symptoms of hypoglycemia and monitor serum glucose and glycosated hemoglobin periodically during therapy to evaluate the effectiveness of the drug. The other drug that is most important is octreotide. Octreotide delays gastric emptying. It also slows transit through the small bowel, and it also increases intestinal absorption of water and sodium. Octreotide has three benefits to the patient who has dumping syndrome. These benefits are: it delays gastric emptying, it also slows the transit through the small bowel, and it also increases intestinal absorption of water and sodium. Remember, in this condition, we said water moves from the surrounding tissues into the intestines, and this can lead into hypotension because of reduced blood volume. So this drug is given 50 to 100 micrograms subcutaneous injection 30 minutes before each meal. Octreotide LAR, this is 20 milligram intramuscular injection given every 4 weeks. So the side effects is painful injection. It's very painful. It's good to take note of that. Diarrhea, it can lead to gallstone formation and steatorrhea, and also weight gain. The symptoms targeted are those of the early and late dumping. So the nursing implication when the patient is taking this drug is to assess the frequency and consistency of stools and bowel sounds throughout the therapy. The other thing is to monitor pulse and blood pressure before and periodically during the therapy. Therefore, and periodically during the therapy. The other thing is assess patient's fluid and electrolyte balance and skin turgor for dehydration. Also assess for gallbladder disease. Remember, this is a drug that has been associated with gallstone formation. So assess for gallbladder pain periodically during the prolonged therapy. The other types of drugs that can be used in dumping syndrome are anticholinergics. Anticholinergics, they slow the gastric emptying, and they are also antispasmodic drugs. They are given 20 to 40 milligrams 3 times a day for 30 minutes before a meal. They can cause paralytic ileus, constipation, heartburn, dry mouth, nausea, and vomiting. Remember, these anticholinergic drugs, the side effects, we have the GI, nausea and vomiting, and dry mouth. They can cause heartburn, constipation, and paralytic ileus. The symptoms targeted are early and late dumping. Early and late dumping symptoms, they are targeted by the anticholinergics. So nursing implications: assess for symptoms of irritable bowel syndrome before and during therapy, assess for abdominal distension, and ascertain for the bowel sounds. Monitor intake and output ratios. This may cause urinary retention. So it's good to remember the pharmacological interventions. We have drugs, acarbose, octreotide LAR, and anticholinergic. What are the surgical interventions? The surgical interventions are usually considered as a last resort. They may be necessary for dumping syndrome sufferers who have been compliant with dietary and pharmacological therapy for at least 1 year, but continue to be troubled by their symptoms. So several surgical procedures have been deemed somewhat successful in treating dumping syndrome, but they are not always curative. So the choice of intervention depends on the precipitated patient symptoms. For example, a pyloric reconstruction may be used for patients who previously underwent pyloroplasty. This is a procedure that is done to widen the opening of the lower part of the stomach pylorus to allow increased emptying into the small intestine. You can also do Roux-en-Y. A bariatric procedure is an option for patients whose dumping syndrome began after a partial gastrectomy. The other thing, for patients with unmanageable symptoms, they may undergo placement of a continuous enterojejunostomy feeding tube. And now there's to completely bypass the upper GI system. Now, this procedure, you might need to know that it impairs the patient's quality of life. They need to use this feeding tube, and now this is quite uncomfortable for them. So those are the surgical interventions for patients with dumping syndrome. Let us now look at nursing intervention. Number one thing about dumping syndrome is patient education. This is important in ensuring that the patient understands their condition and its treatment, providing dietary instructions again and again and again to these patients, and promoting their self-management when they are suffering from this condition. Stress the importance of learning what foods trigger or aggravate their symptoms, because patient self-management has been shown to be the best approach for controlling early and late dumping syndrome. The other thing, positioning. Position the patient in low pholas position for 20 to 30 minutes after a meal to help with delaying gastric emptying and minimize their symptoms. So the patient should lie not in a high pholas position, but a low pholas position, a reclined position, and this helps with delaying the gastric emptying and minimizing the symptoms. So if the patient is exhibiting symptoms of late dumping, that is symptoms of hypoglycemia, give him or her small amounts of fast-acting carbohydrates. For example, you can give a fruit juice or a regular soda. The symptoms typically subside within 10 to 15 minutes after consumption. So you need also to warn the patient that they have a risk of falling. There is a risk of falling if they feel dizzy, weak, or lightheadedness. And if they need to rush to the bathroom, tell them to take note of these symptoms. When they feel dizzy, weak, or lightheadedness, they should report that, because that poses a risk for falling. To avoid dumping syndrome symptoms after tube feeding, ensure that the formula is at the room temperature. Instill the feeding slowly via continuous IV drip. Keep the patient in a semi-pholas position for 1 hour after feeding. So we have come to the end of dumping syndrome. It's a topic that is quite tested in the NCLEX, so it is good to know how to manage patients with dumping syndrome. We always give you a chance to test yourself, to test your understanding of this topic with 10 NCLEX style questions. So we have prepared for you 10 questions. There will also be answers and their rationale for you to be able to gauge your understanding of the topic. We want you to be able to understand this topic, so whenever in future a question will be asked about this condition, dumping syndrome, you'll be able to give the correct answer. So welcome, and continue with the questions. So thank you so much for being with us throughout this whole session. We have learned about dumping syndrome, the causes of dumping syndrome, all the aggravating factors, the type of food to avoid, and also we have learned about the management of this condition. Keep in mind all that and continue revising for your exam. Look for other videos that we have uploaded in our YouTube channel, and if you have not subscribed, kindly subscribe to this YouTube channel. It is going to help you to get notification every time we upload a video. These videos are meant to assist you with passing the NCLEX exam within the very first attempt. So kindly go there, subscribe, and even like those videos and share even to other nurses so that they can get to benefit just like you from our videos. So let us see each other in our next video. Thank you.